UroPal, a safe and clean urinary catheterization system. UroPal was developed to make urinary stoma catheterization fast, clean, safe, and completely self-contained for home, work, school, and travel use. These benefits reduce the amount of work required for each catheterization event, thereby providing a much greater level of normalcy to the life of a person with a urostomy. Using UroPal is simple. First, assemble the device by screwing the tube into the syringe assembly. Second, make sure that the drainage bag valve is in the closed position. When it is in the closed position, the blue valve is in line with the white drainage tube. When it is open, it is 90 degrees from the white drainage tube. Please make sure that it is closed before UroPal is used. Attach the catheter to the UroPal, making sure, if you're using a hydrophilic catheter, that the foil pouch full of saline has been popped and the catheter is adequately lubricated. Pull the catheter out of its package. You are now ready to catheterize, which we are simulating today with a bag with green fluid. Insert the catheter into the stoma, fully into the person who is being catheterized. Once the catheter is fully inserted into the stoma, you can now begin pumping the syringe back and forth like a bicycle pump, and you cannot pull the plunger all the way out of the syringe because there is a zip tie as a stop that prevents you from pulling it all the way out and making a mess. Once your syringe is full, you can now push the contents of the syringe into the drainage bag and work the syringe back and forth just like a bicycle pump to keep the urine going into the drainage bag. An alternate method is, instead of using the syringe to pump back and forth, is you can take your drainage bag and hang it down below the UroPal. You can hang the strap on the person's foot who's being catheterized, or also hang it on a piece of furniture, and hang it down below. And once there is adequate fluid inside the drainage tube, you can now empty the bladder just by using the power of gravity. Sometimes if there are bubbles in the tube, put some bubbles in it, you can tell which way the fluid is going just by watching the bubbles inside the tube. If the bubbles are traveling downward, the fluid is traveling into the drainage bag. So without pumping the syringe, you can completely drain the bladder. As pockets of urine are drained from the bladder, you can pull the catheter out and continue to void the bladder. Once the bladder is empty, you can pull the catheter out, run some additional air to clear the system, remove the catheter, throw it in the trash, and the UroPal is now ready to be emptied into a toilet simulated by this tray. Take the drainage bag, turn it upside down, turn the blue valve knob, and drain the contents of the bag into the toilet. Once it's empty, close the valve, and we can now run some water through the UroPal to rinse it. You can either take a cup with water in it, or your sink. Put some water in your sink, run 1 syringe full of water through the system into the bag, slosh it around a little bit to rinse it. Once again, drain the contents into the toilet. Making very sure to close the valve for next use. If you do not, the urine will not stay in the bag during next use. You now roll your UroPal up and store it for next use. UroPal is good for 100 uses. It is made of medical grade parts, and the syringe, if required, can be removed and replaced if the syringe becomes difficult to use due to accumulation of urinary sediment. And once again, UroPal is manufactured by Warren Innovative Technologies of Fayetteville, North Carolina.